what is arthritis? What does it mean when you have arthritis? This is an important question we need to answer because I hear people saying things all the time like their whole body hurts, it must be their arthritis flaring up. Like their arthritis is some disease living in their entire body. And that's not how it works. My name is Rob Drenning. I'm a physical therapist. We're going to talk about that today. And in particular, we're talking about osteoarthritis. That's the arthritis that most of us think of when we think of the wearing down of our joints as we get older, that type of arthritis. There are other kinds associated with more general inflammation that can be through our whole body. But let's talk about osteoarthritis for a minute. This is a very specific change that happens in a very specific joint. Our joints have two bones, and in between them is a bunch of fluid. Over time, we lose water in that fluid, and those two bones get closer and closer together. Now, when they take an x-ray, depending on the joint, they measure the distance between those two bones, and once it hits a certain criteria, you get the diagnosis of osteoarthritis. This is a very common thing to have, but it happens in one specific joint. It doesn't happen in every joint all through your body at the same time. There are a lot of factors that play into this. It's very common even to have arthritis with no pain. You might have it and don't even know about. For example, in your knees, 30 to 50% of people over a certain age have arthritis in their knees, but no pain whatsoever. They just don't know it. In the back, degenerative disc disease is a really common thing that we see on x-rays and MRIs. It's the same thing. You lose water in your discs. They get closer together. Over the age of 30, you have a 40% chance of having degenerative disc disease and no pain whatsoever. Over the age of 50, 80% of us have degenerative disc disease in our back, but no pain because of it. So that's an important distinction. Arthritis in a joint does not mean it's a painful, inflamed, and irritated joint. It can get to that point, but just because you have arthritis on an x-ray or an imaging finding, it's not an indicator that you need to be afraid to be active and to live your life. If you have it in one joint, are you more likely to get it in others? The answer is yes. There is a slight increased risk if you have it in certain joints that you can get it in others. And that's because of multiple things, age, body characteristics, just biomechanics that we all have. But it's not inevitable and it's not a guarantee. You can have a bunch of injuries in your knee and get arthritis in that knee and never have arthritis anywhere in the rest of your body for the rest of your life. So I hope that helps clear up a little bit of just what arthritis is. It's very specific to one joint. It doesn't mean it has to be painful. And if you have arthritis that is painful, that can oftentimes go away as well. It just takes the right approach. Let me know if you have any questions, comments, concerns about your own arthritis.